Well, welcome everybody. It's a beautiful summer day, and I'm glad you're spending some time with us. And today we're very, very happy to have Hope Young with us again. Hope is with Kokua, which is I guess you call it a movement, and to improve care and support those with serious illness and their loved ones, promoting meaningful, thoughtful, and sensitive conversations. Everything from advanced care planning to just general end of life. How do we deal with that whole part of life? But today, Hope is going to share some information with us on palliative care. And that's a strategy to improve care, provide relief from symptoms and stresses of an illness, not necessarily like hospice, where there's an immediate, not immediate, but a fairly short life expectancy period. Palliative care is designed more to carry you through the complexity of an illness. So the whole goal is to improve the quality of life for both the patient and the family. Hope is an advanced care planning expert, a community education expert, but mostly, I think, an advocate for understanding and utilizing palliative care services and understanding services that are related to hospice. So, Hope, take it away. We're really looking forward to learning from you.
Thanks, Gary. Let me get all set up here and share my screen with you folks. Everybody good to go? Okay. So I am Hope Young from Kokua. Some of you are familiar faces, so hello to you all. A little bit more about Kokua is we are a 501c3 community benefit organization. We're statewide, but we are not a state agency. We are actually celebrating 25 years of being an organization supporting people out there in the community. We are supported through memberships, and our members include health plans, hospitals, we have hospices, we have churches and temples and home health. We have a variety of different agencies that see the value and have supported us through membership. We also have individual members, which also support us through their membership. I get the joy of working with passionate volunteers across the state. Our volunteers include social workers, nurses. I have a few doctors, some retirees. These are the people who are seeing frontline what happens when people don't have these conversations, and they have witnessed the fistfights outside of the ICU. They can tell you stories about seeing the fights in the middle of the hallways or in the parking lot. So they have decided to volunteer their time and spend it with us as we spread this movement to improve care through, oh, sorry, my mouse is jumping. There we go. And we concentrate on the continuum of care, which is advanced care planning, post, palliative care, hospice, and bereavement. And so our three areas of activity is we work with people who may be facing serious illness as well as their loved ones. We want to help them understand decisions they may be faced with as early as possible. We want people to have these conversations while we're still healthy and able to think about what matters most to us and what we would want or what we wouldn't want should the time come where we need more care. We provide professional networking and training, and then we dabble a little in policy, not too much though. Kokua, we think of ourselves, as Gary said, as leading a move. Oh, ghost in the machine, sorry. Kokua is leading a movement that aims to make advanced care planning and open communication about care and support for those with serious illness and their loved ones, including end-of-life care, the cultural norm. We want to get people talking about these things early. So Dr. Ira Byock has a great saying: modern medicine has yet to make even one person immortal. Therefore, at some point, more treatment does not equal better care. And this is something that we all can take into consideration as caregivers and as for our loved ones, the ones that we're caring for. We cannot change the outcome, but we can totally affect the journey. Thank you, Ann Richardson. So feel free, I'm going to ask you this, it's a small enough group. When you hear the word palliative care, what do you think of? Go ahead and drop it in the chat. And for whatever reason, I am not seeing the chat. There we go. Okay. Sorry, I have to move this around so I can see things. Pain management, considerate care, comfort care, supportive care, team approach. Love it. You guys are on the right track. Palliative care is often misunderstood, and oftentimes we hear people confuse palliative care with hospice. And we want to make sure that folks really understand that they're the same type of care, but they're for different goals. Hospice care is with end of life in mind. Palliative care, we're looking at support during a serious illness to support the loved ones and the patient. So they're alike, but they're different. And we want to make sure that folks understand that palliative care is actually something that can really support not only the patient, but the family. So a short definition for palliative care is that it can help people with serious illness stay at home rather than having to go to the ER or the hospital. It reduces physical discomfort and provides improvement for quality of life and makes living with a serious illness easier. Again, this is intended for both the caregiver and the patient. It's not just for the patient. We have a bunch of information on our webpage that if you'd like to delve further into this, these are all the different things that we have on our website. I'm going to be brief about what we're sharing, but if you think maybe it's something that's good for you to get involved with palliative care, feel free to go check out our website because there's all these different pages that we have recently developed because of some new benefits, and I'll get into that in a little bit. So this is a kind of a big picture of what palliative care is. Palliative care is the largest of those circles, right? So it's optimizing quality of life. It's advanced care planning. It's early symptom management. It's used to approach people with a life-limiting illness or with an illness that could cause serious illness and they need additional support. Whereas palliative care would be hospice care would be the end of life, that section. So we really want to broaden the type of care that's offered to serious illness patients. Why do we want to get palliative care involved? Well, it's an early upstream intervention. It's really going to allow for additional support. This is going to be provided by a team, which is going to work with PCPs or specialists, and they are going to work as a team to help support the patient during this illness. Now, keep in mind, palliative care, in some cases, people go on palliative care, and once their illness has been relieved, they get off of palliative care. So it could be somebody who's dealing with a cancer treatment, and they need that extra support. And then when they go into remission, they're taken off palliative care. It can also be kind of your segue into hospice. So really, it's not one or another. It could be either. And really what it's intended to do is to work with your providers to provide the specialty care that you need to get support in the home setting or wherever the person calls home. It's appropriate at any age and at any stage in a serious illness. And keep in mind, we can continue with curative treatment. So if we're getting cancer treatments, radiation, chemotherapy, we can continue with that and have this team in place to support people. Again, it's an extra layer of support for people facing a serious illness. Where can you find palliative care? There are various forms of palliative care that is out there. Things that are established right now are inpatient palliative care. So when you're in a hospital, you can ask for a palliative care consult and have a palliative team come and provide that support and services in the hospital. Outpatient, they have oncology clinics. Kaiser had their own clinics. It really varies, but outpatient is when a person goes back to the hospital to get the palliative care. In-home care, palliative care, especially for the island of Oahu, most of the hospice agencies offer some sort of palliative care services. That depend on what type of insurance you have. HMSA, UHA, and VA all offer it. Many of the other Humana, UHC, all these other different insurance are offering some sort of palliative care. The agencies that are providing palliative care include the hospices, most of the hospices on Oahu. On the outer islands, it varies depending on what their staffing is, if they're able to do it. But from my understanding is most of the outer island hospices are creating some sort of program. Now, I want to get to another point, but I'll get back to this because these are the various organizations that are doing it now. But we do have an exciting benefit that's come out, and I will tell you more about it in just a bit. And I see somebody's waiting in the waiting room. There we go. So when do we want palliative care? Some signs that maybe we should ask for a palliative care consult. And really what that is getting someone outside involved and having them evaluate whether this patient could benefit from this additional team providing services. Now, a palliative care team could include a nurse, a doctor, social worker, maybe it could be a physical therapist, a respiratory therapist, it could be a dietitian, all these different facets to palliative care can offer a person who is suffering from a serious illness. And really, the point is to support the suffering. But if you find, we're doing a lot more ER visits, we're calling the doctor more often, maybe there's a problem managing medications. If you notice that there's a decline, they're not doing their activities of daily living what they once were. If they've got pain, swelling, maybe a hard time sleeping, they could qualify for getting palliative care. We want to encourage folks to ask about palliative care at the time of diagnosis. Get involved. You may not be ready for that level of intervention, but knowing your options can really help. And knowing who's out there, giving you that opportunity to decide what agency you'd like to go with. And then throughout the course of the illness, the people with medical issues could actually live longer and have a better quality of life by accessing palliative care early. And really, what it is you're getting that extra clinical support in the home setting, wherever they call home, that can kind of monitor on a regular basis versus having to go to doctor every time something's going on. Or this is really palliative care is good for. People ideal staying at home. You've talked to people who have been in a hospital, they're like, yes, send me home. I want to go home already. This is going to support them at home, providing the best quality of life and relief from symptoms and pain and stress for the caregiver as well, because the caregiver no longer has to manage all the different doctors and try to figure it out. Now you're going to have a team that is going to be working with your PCP specialists. They're all going to be working together and communicating with each other. So caregiver is no longer responsible for that part, but you can still be involved and be a part of the team, including yourself wherever you are appropriate to help and support. It is matching treatment options to patient goals. And really, it's a team approach. And once that team gets involved with palliative care, they're going to look at what's the patient's wishes, what's the patient's symptoms, and how can we support this patient? So I just want to share a quick story. I actually had a classmate. She was in Hilo, and they have a very prominent palliative care program, which is called Kupu Care. And when she was diagnosed with her cancer and it came back, I called her up and I said, you need to get involved with palliative care. And she kind of dragged her feet because there was so much else going on around her. And so when she finally got into the program, I asked her, how was the intake? And she said, well, the social worker really threw me off. The nurse came in, looked at all my medical records and everything, and we were good to go. The social worker came in and asked me all these weird questions, like, what else am I suffering from? Or the things that I'm worried about, things like that. And I said, oh. And so what did you tell her? She said, well, I took an extra month off by accident. So I am worried about finances. I am worried, okay, if I'm worried about finances, do I pay for food or do I pay for rent? My son's not doing well with this diagnosis, and he's really kind of, I can see him not dealing with this very well. I said, great. So you told the social worker all of this. She said, would you believe this? Social worker came back with a grant to pay for my rent for that month, got me on SNAP benefits. And then she had the chaplain come and talk to my son. She said that all happened within a week's time. And That gave her so much help with her own stress because of all the things that were going on. And then when she was in the middle of her treatments, she'd have the palliative care nurse that she could call and tell her, I'm feeling nauseous, something's going on. The nurse would go and pick up her medications and deliver it to her. That's the level of care that can be provided with these palliative care services in place, which is not something that we're used to seeing. Usually we have to go to the doctor to get help. But with a good palliative care program, this is something that could really change the lives of people who are going through a serious illness. I like to share this visual with you just so you get an idea. Um, Really, when you have palliative care in place, all of these admissions and readmissions and hospital costs, they go down. So you were really supporting the patient in a way that they're getting good care in a setting that is not an ER. And they're getting the best care possible. And it's reducing the amount of visits that are needed, need to go to the ER for whatever reasons. And in this blue box, it's showing the quality of life goes up and the symptom burdens go down, which is really a good thing if you're dealing with a serious illness. And I like that number. Drives high satisfaction and positive patient experience. At 93%, that's pretty darn good. So palliative care helps you live as well as possible for as long as possible. And it's just the way care should be. We have seen specialists kind of live in silos. So sometimes if you have more than one specialist, you won't necessarily see that specialist communicating with other specialists or with the PCP. Oftentimes it's kind of segmented. And this is a way to bridge those gaps and make sure that the care is provided the way it really should be. Some public misperceptions about palliative care. I'm not going to read you all the facts, but palliative care is not just for pain management. It is not the same thing as hospice. It is not just for cancer patients. And it does not mean stopping of any treatments. Really, palliative care can broaden the amount of care that is brought into the home setting to support the caregiver with caring for their loved ones. Now, I kind of touched on it a little bit earlier. MedQuest has now come out with a palliative care benefit services. So all MedQuest members will be eligible for this. This benefit is brand new, so it's a baby. It just went into effect January 1st of 2025, which means they are in the planning processes out there in the community. They're trying to figure out billing. They're trying to figure out, all the different codes and how do we do these intake forms and how do we do the referral forms. So it is in its baby stages, but it does offer a much broader diagnosis for people who are suffering from a serious illness and living in the community. And it's intended to support them throughout their illness. So there's not a limitation on how much time they can be on the palliative care benefit services. It's brought in the diagnoses and the types of diagnosis, including dementia care. So this is something that's kind of unheard of, offering support to family members for people who have dementia. We created some videos that are available for you to watch so you can learn more about it. We have a YouTube channel. Feel free to go check it out there. But the one that really, if your loved ones has Quest, I would say webinar 4 is probably the best one to take a look at. But all of them have great information. It's talking to some experts throughout the state who can tell you more about what these services are going to provide. If you want to know the nuts and bolts of the actual benefit, that would be webinar 1 and 2, where the creator of the benefit actually explains about the services, the benefits, and the intention behind the services. What we do recommend for folks is that if you want to find out whether if you're able to get palliative care services, reach out to the agencies that are currently offering palliative care. Again, those are the same agencies that offer hospice care, but they can do the legwork for you. You don't necessarily have to figure it all out yourself. These agencies have social workers that are tasked with figuring out your insurance and what you qualify for and what programs might be available if the palliative care benefit services is not. So really, those are part of the team that you can include to finding out what you can qualify for. And again, they will do the legwork for you. So I'm gonna like open it up a little bit and see if you guys have questions for me, because I wanted to give you a few minutes of Q&A. But by all means, if you're not familiar with Kokua, we invite you to come take a look at our website and view all the things that we have as resources. They're all free to download. If you'd like any presentations or a speaker to come to talk to your group, if it's not me, it's one of our wonderful volunteers. We're happy to do that and customize it to whatever needs you have. I think the last time I talked to to the Caregiver Support Group, it was about advanced care planning. So again, we will customize it for whatever you want, and we will make sure that you're getting the information that your group could benefit from. These are the things that we have translated into 13 different languages. Our most recent translations include Olelo Ni'ihau, as well as Samoan language. And we wanted to make sure that you know that if language is a barrier, we have things that are available already translated to be used with your loved ones. I'm going to leave my contact information up there for a minute, just so you know how to get in touch with me. Again, I'm Hope. Jeanette will be on vacation, so if you reach out to her, she might not answer you for another 2.5 weeks. I want to open it up to you folks and ask you, what questions do you have for me? Anything I can support you with? Yes, Leanne.
Well, I have some questions, but I do want to give a shout out to Kokua and for our caregivers, sign up for their newsletter. It comes out monthly, sometimes more frequently, with lots and lots and lots of not only Kokua resources, but community resources, events and other offerings by other agencies. And then go to the website and let's see kokuamau.org.
Yes. Sorry, it's not on there.
Yeah, access all of their webinars, documents. It's just a tremendous resource. So I gotta ask a kind of basic question.
Please do.
We're talking about serious illness. So is there a known definition among the medical community or insurance community for serious illness that would then be the gateway to palliative care?
So it's a great question. Have you all got this information? I'm going to stop sharing and make my face big so I can see your face is big. Okay. So that's a great question. And serious illness is defined differently by different organizations. So it's kind of like take into consideration who's saying what, because if you ask American Heart Association, they're going to have something very different than the Diabetes Association. So really what we like to say, kind of rule of thumb, if someone is having problems with their ADLs, their activities of daily living, and they have a diagnosis of some sorts, something, it could be liver disease, it could be kidney disease, it could be cancer, it could be any of these diagnoses that a doctor has said, you have something that is going to affect your livelihood for the rest of your life. That is meant to be a good broad version of what a serious illness is, because it's such a broad term. We want people to think, hey, if this is going to be affecting my loved one, this diagnosis is going to be affecting my loved one, whether it's now or sometime in the future. Let's see what we can qualify for if we're at that point yet. And also let me as the caregiver have that opportunity to take a look at all these different programs and see which one I would want to work with, because all the different agencies have different programs. And it's a really nice opportunity to do a little bit of homework ahead of time before you really, really need them in place. And we don't recommend one over another because they all each have their own programs that are, some are even beyond what palliative care is. Some they do appointment transfers. Some they do, they work with meal delivery organizations. It varies, which is why it's such a broad thing right now. And of course, this Quest benefit is going to narrow it down. So hopefully, once they get that all settled, it'll narrow everything down so everybody's on the same playing field. In the past, palliative care has been called different things. So because it's always been called different things, people don't really know what to think of that. So we're really trying to get it to the point where it's honed in, people understand what it is and when to call for it. And that would be your broad understanding of serious illness.
Okay, thank you. And I invite the caregivers on the Zoom, if you have a question, to just physically raise your hand or use the hand in the react button on the bottom row, typically on the bottom row of your screen, and you can ask your question directly to Hope. But I have another question, because when you were asking for what are our
Definition?
the idea's definition of palliative care, I said a team approach. So I guess I was thinking more of a coordinator for the doctor currently in place, but you're talking about another team that offers more, for lack of a better word, umbrella, kind of for services over what the PCP and specialists are offering.
Correct. And what's really nice about having that care coordination in place is that now right hand and left hand both know what's going on, and they're going to be working together to help support the patient and the family. A lot of the challenges, at least I remember from when I was a caregiver, was cardiologist did not know what gerontologist was doing. And it kind of, okay, I have to go back and forth and say this and that and kind of be the relay. This takes that relay thing out of the equation, and there's somebody already involved kind of coordinating with whatever needs are at the time. So it's a new team that's added into the mix.